Before we dive into gallstones and acute cholecystitis, let's first take a moment to understand the gallbladder and its normal function. The gallbladder, a small pear-shaped organ located under the liver, plays a significant role in our digestive system. It stores a fluid known as bile, which is produced by the liver to digest fats. When food, particularly fatty food, enters the small intestine, the gallbladder releases this bile into the bile duct. This process aids in the breakdown and absorption of dietary fats. Now that we've set the stage with a basic understanding of the gallbladder's function and anatomy, let's delve into the world of gallstones and acute cholecystitis. Ever wonder why gallstones and the resulting acute cholecystitis are such a prevalent issue in our society? Today, we delve into this common health concern, breaking down the statistics, identifying symptoms, discussing diagnostic procedures, and exploring treatment options. In the United States alone, between 10 and 20% of the population have gallstones. Astonishingly, up to a third of these individuals will develop acute cholecystitis. This makes cholecystectomy, or gallbladder removal, one of the most frequently performed major surgical procedures. Age plays a significant role in the incidence of cholecystitis, with the elderly experiencing a higher prevalence. Women are 2 to 3 times more likely to develop gallstones than men, leading to a higher incidence of calculous cholecystitis. However, a calculous cholecystitis often occurs more frequently in elderly men. The symptoms of acute cholecystitis can vary, but common ones include upper abdominal pain that may radiate to the right shoulder or scapula, nausea, vomiting, and fever. The pain often begins in the epigastric region before localizing to the right upper quadrant. Tenderness in the right upper quadrant or epigastric region, a palpable tender gallbladder or fullness of the right upper quadrant, and jaundice in some cases are other common symptoms. Elderly patients, particularly those with diabetes, may present with more vague symptoms. The diagnosis of acute cholecystitis begins with a physical examination, where the healthcare provider will evaluate pain, tenderness, and signs of peritoneal irritation. Laboratory tests, including a complete blood count, liver function tests, and amylase levels, are also essential. An ultrasound is often the first choice imaging technique for diagnosing acute cholecystitis. However, kinetic scanning and MRI can also be used, the latter being a suitable choice for pregnant women to eliminate radiation exposure. Treatment for acute cholecystitis initially includes bowel rest, intravenous hydration, correction of electrolyte abnormalities, analgesia, and intravenous antibiotics. In mild cases, antibiotic therapy and outpatient care might suffice. However, early cholecystectomy is typically recommended, with laparoscopic cholecystectomy being the preferred approach. It's important to remember that this procedure carries a risk of complications, including mortality, bile duct injury, and major post-operative complications. Post-treatment care involves educating patients about their disease, the complications if left untreated, and the medical and surgical treatment options available. After cholecystectomy, patients should follow their healthcare provider's instructions for wound care, pain management, and gradually returning to normal activities. Remember, early recognition and intervention for acute cholecystitis are crucial to prevent poor outcomes. If you or someone you know is experiencing these symptoms, seek medical attention immediately for proper diagnosis and treatment. Before we conclude, we encourage you to take a proactive approach to your health. Please like this video, hit that notification button so you don't miss out on our upcoming health discussions, and subscribe to our YouTube channel for more comprehensive health content. Your health matters to us, and we look forward to guiding you on your journey to wellness.